Uh, um, you know, I look at the research. I look at the research that was done on the various drugs that are now on the market. I look at the Prozac, and I look at the Xanax research. Prozac got on the market and was approved by the FDA essentially based on clinical trials that extended for 6 weeks. Xanax, to which about 1.5 million people in this country are presently addicted, is the most severely addictive pharmaceutical substance in the United States. And then, of course, the non-prescriptive items, the tobacco and alcohol, which we don't call drugs anyway. There's something else. The Xanax was about an 8-week trial involving not more than 126 patients. The first 4 weeks of the trial were quite positive in regards to the Xanax. The second 4 weeks showed that the placebo worked equally as well as the Xanax with none of the negative side effects. They scrapped the second 4 weeks. It was approved by the FDA based on those trials.
Yes, I'd like to make a comment about safety, because we have a lot of people asking my company, Tools for Exploration, whether cranial-electrical stimulation is safe. And I think that there's
It's an extraordinarily interesting one, especially the extent to which people don't really think about this when they take the prescribed pharmaceuticals that their doctors. I mean, doctors essentially become prescription machines. People go to doctors and essentially for a prescription. If they fail to to leave without one in hand, they feel the visit has not been at all successful. I was talking to a parent recently about CES and whose child suffering from attention deficit disorder, which is either a real or imagined problem. It's very real for the, again, I take that back. I take that back. It's very real, okay, for the person experiencing it. I worry about these categories that have been created. Learning disabilities, attention deficit disorder, hyperactivity, et cetera. There's an extraordinary book by Diane Schrag and Diane Savaki and Peter Schrag called The Myth of the Hyperactive Child. But at any rate, this myth is very real for lots of people. And we're talking about 800,000 kids a year that are on Ritalin, and basically amphetamine, and are future drug addicts. And we know that it is not necessary. I talked to this parent about utilizing CES in lieu of the Ritalin, but she was afraid, you know, what it would mean to put electrical stimulation to her kid's brain. And I couldn't convince her to the contrary. She'd much rather put the kid on Ritalin. Yeah. One of our problems has been to somehow scale our claims down, to make them as modest as possible. I've told somebody I have these dreadful fears of becoming Pacific Northwest Lourdes or something, because people keep calling me up and saying, my God, I used this for this, and I used this for that, and I had extraordinary success. And I'm trying to limit the claims along those lines. What is TMJ? It is a stress disorder. And people have gotten relief from in terms of TMJ problems utilizing CES.
I'm sorry, but I really don't understand what the machine actually does to relieve the stress and anxiety.
Okay. When you're in a stress situation, or you're suffering from, say, a problem of an external substance, such as alcohol or heroin or cocaine or amphetamines or whatever, the various neurotransmitters that control and define your moods and emotions are out of kilter. Those neurotransmitters, in turn, are impacted on by your electronic circuitry of your brain, your electrical activity of your brain. If you have an electrical brain dysrhythm, and that electrical brain dysrhythm is normalized, it will impact positively on those neurotransmitters and will help get those neurotransmitters back into pre-stress homeostasis, back into balance again. The overall sense that one gets from utilizing CES is that of balance, of centeredness, of quietness. You're not a limp dish rag. At the same time, you're not frenetic, crazy, going up and down like this. CES, as I said, is not terribly sexy. It's not terribly dramatic. What it is about is an evenness, of being able to approach and deal with issues in an even, quiet, calm, centered fashion. So there's much less of this going on in your life. We find that it works, as I'm talking now, just wearing the unit for any I could walk around with the unit, I could watch TV, I can read. But we also say to people, think about using the unit by clearing some space and time to be with yourself in a different way. Just put the unit on and sit quietly. Well, somebody says, well, that's sort of a form of meditation. Well, yes, it is in some ways. Where does the body leave off and the mind begin, and vice versa? Which happens first, neurotransmitter activity, or you're sitting quietly? I don't know. It's all of one piece, all of one fabric. Again, a very non-sexy unit. People want to see, you know, what's going to happen? Is it going to fix me? Is it going to do something dramatic? No. It operates in a very quiet, in a very subtle fashion, but in a very effective way. And people have seen results.
How about people that meditate or into meditation?
I use it when I meditate.
But people that achieve that same, can people achieve that same state without using meditation? You're talking about even centeredness and...
Yeah, possibly. Mm-hmm. Yeah. I think they, my sense is that, again, that these were skills, these were talents, these were things we knew how to do once upon a time. We've since long forgotten how to do it. We need to be reminded of it. I think in some ways, too, the CES can serve as a training wheels of sorts for people. People talk about knowing a relaxed state, being in a relaxed and centered state, but they really don't know it. If only the CES informs you of what such a state is really like, and then you can put the CES unit away, you can learn how to do that by yourself. Sure. I think it's also a matter of putting all this technology into proper perspective. These are just tools. People call me up all the time, will this fix me? Will this change my life? Will this turn things around? No, please. All this is a tool. A tool. It's something that you're going to be using on your own behalf. Don't empower this little black box. Empower yourself. This is what it's really all about. Yeah.
There's a unit that I'm aware of that uses both CES and light and sound stimulation at the same time. Do you have any feeling about that?
Yeah, I'm from the less is better school. I really like to keep it real simple. When we began to design our unit, we said, you know, what are we going for? And as I said earlier, we went for Mr. Coffee. As simple and as austere as possible. Single knob. And we say to people, by the way, again, that ideally, turn it down below the sensate threshold. In other words, you don't need the tingling sensation itself. But people, and this culture being what it is, people want to know, is something happening? Is something really happening? So they turn the tingle up, and they say, well, let's have more tingle. More tingle is better. Up goes the tingle. Drug addicts, substance abusers, alcoholics, wow, turn it all the way up. And wow, you get your face twitching, your lips twitching. I don't know. I don't happen to be a sensation junkie myself, and I'm not really interested in it. And what happens, by the way, is if you can operate below the sensate threshold and sit quietly, over a period of time, you'll find yourself less preoccupied with the external stimulation and more so turning inwardly and getting in touch with those inner shiftings. You will begin to sense what those inner shiftings are really like and begin to flow and move with them in a natural fashion. If you are constantly preoccupied with something happening externally, it makes it much more difficult to do so. As I said, this is a rather unique unit, and one of the things that we're trying to do, and I spoke to Julian about this yesterday, is we're trying to sell not a device, but a product. And by a product, I mean it's something that also has a philosophy and has some kind of larger framework of values around it. And we're not just selling a little black box that's going to fix you. We want you to be able to use this and use this in some proper way. We also feel that there's a whole attitude about health and about emotional well-being that goes along with the use of this unit. Now, I don't know whether I answered your question about the light and sound combination with the CES. Again, as I said, I'm just not from the more is better school. I don't think you need all that extra stimulation, personally. I believe the CES, somebody says to me, well, you know, I use it once a day, twice a day. I use it all the time. No, you don't need to use it all the time. How many times do you need to normalize? I mean, essentially, once your neurotransmitters have been brought to pre-stress homeostasis, there is that calming, there is that centered feeling. And you're able to operate at that state of relaxed awareness. You're able to operate with great clarity and with great ease. And isn't that really what it's all about, instead of being an excitement or sensation junkie? And this is not a put-down of the light and sound, Robert. Not in your own house. But it just happens to be part of the perspective from which I operate. Okay? Yeah.
Yeah, I'd really like to know a couple of things. One, how often do you use this machine yourself?
Okay, I'll take that one question at a time. The frequency of use, we generally say to people, we recommend they start off with it twice a day, once in the morning and once in the evening. And it has a built-in 45-minute timer, so the unit shuts off automatically at the end of 45 minutes. We feel a 45-minute session is more than sufficient. We also say to them, you can use it during the course of a day, during peak moments of anxiety or stress or depression. Something hits you like a ton of bricks in the course of a day. You get real angry, really get hurt, and furious. You sort of lose it, which happens to the best of us in the course of a day. it's really nice to actually stop and take time out and recognize that fact. And even if you're just using the unit as an excuse for stopping what you're doing and clearing that space and being with yourself in a different kind of way, that in and of itself is a very positive thing. And so use it for 5 or 10 minutes in those situations as well. It will help round off that anxiety, curb that anger or that tension, and allow you to get back to that position, again, of calmness and centeredness. Over a period of time, people themselves will begin to understand best how to employ the unit. And this is what, again, what makes it so difficult. You know, you go to a doctor, and doctor says, well, you know, take 2 in the morning, take 2 in the evening, take 1 every other, after lunch every day, or 1 after every meal. It's not that way with the CES. We say start off with it twice a day. You then may go down to once a day. You may then feel that calmness and centeredness about you and feel there was no need for the unit for the next week or 2. You put it away. A crisis then hits. You need to get a different kind of perspective on things. The unit then comes back into play again. You develop a very special relationship with the unit. And what I'm saying, again, is this is not something that's a knee-jerk automatic reflex mechanism. This is something that you use and you learn how to use. It's your unit, and you have a very special relationship with it. And this means that you and not the modality itself is being empowered. That's generally our attitude. Tara?
Yeah, but on the other hand, there's also some data, isn't there, that excessive usage can lead to habituation, not in the sense of addiction to the unit, but the effect becoming less effective. Have you any evidence of that yourself?
No. No, we haven't seen any problems with habituation or addiction. And in fact, we've never, ever heard of anybody becoming addicted to CES. Yeah.
I have a question. You seem to be suggesting that the mechanism of action is that the electrical stimulation, through some mechanism you don't identify, provokes rebalancing of neurotransmitter levels to pre-stress homeostasis. I've heard Ray Smith theorize that the mechanism of action is a restoration of the capacitance of the cells in the brain, and that the increased capacitance of the cells allows the signals to be carried more quickly, and that he uses the metaphor of resetting your odometer back to 0. You're probably familiar with that kind of thinking. Do you know of any evidence or any indicators that give you any insight into the exact mechanism of action?
Okay. Most of the research on CES has been spent on does it work rather than how it works. The Russians are perhaps doing the most extensive work right now on how it works. We haven't got the results yet. They've been doing some using MRIs and PET scans. In fact, Dr. Lebedev spent time at the University of Toronto and at Southwest Medical Center in Dallas this last summer trying to assemble evidence about his theories about how it works, about proper pathways and what really is occurring in the brain. We really don't know. It's all conjecture at this point. We do know via the topographical brain mapping, the computerized EEGs now, that extraordinary changes are occurring in terms of electrical activity after utilization of CES. And I did not utilize any of the slides in keeping with the austere and simple nature of the presentation I opted for, but there's some samples of it I laid over on the table over there that you might want to take a look at. Eric Braverman out in New Jersey has been using the BEAM, the Brain Electrical Activity Mapping System, fairly extensively. And he's been utilizing and zeroing in on the P300 and the cognitive auditory evoked potential and the amount of voltage associated with that particular wave, brainwave. And there's a particular signature that's identified with alcoholics, with substance abusers, and now we find this also to be true of people suffering from chronic fatigue syndrome and from fibromyalgia. And what we notice about that P300 wave is the voltage is extremely diminished. It's about, somewhere between 4.5, maybe at most 6.5 millivolts for the alcoholic or substance abuser. There's something very wrong there, okay, in terms of electrical activity. After 40 minutes of CES, we can see that normalized. We can see it being brought up to about 8, back to normal. It's pretty dramatic. You look at the brain via computerized EEG, a brain of an alcoholic or substance abuser. You look at that P300. It's sort of like an aha phenomenon. The bright yellow, it's pretty dramatic. You look at the brain of the alcoholic or substance abuser. You see diminished electrical activity. 40 minutes of CES, just 40 minutes. You can see it. You can see it again, back to normal.